Hi everybody, my name's Heather Merrill. I'm a pediatric nurse practitioner at the St. Joe's Hospital Pediatric Office in Milford, New Hampshire. And today I'm going to be answering a pretty common question we get in pediatrics regarding the use of ice or heat for sports-related injuries. Summertime is a pretty common season that we see increased injuries related to recreational activities, summer camps, sports. So parents will often ask us whether or not they should use ice or heat for an injury. So ice should be used for an acute injury. So if you have a pulled muscle, you have a pulled ligament, you have a bruise that happened within the last few days, it's important to ice the injury. It helps to decrease the swelling, decrease the blood flow to the area. It can help with inflammation, pain, bruising, anything that is a new injury. If you're going to ice an injury, it's important to do 20 minutes on and 20 minutes off with the ice. I also recommend wrapping your ice pack in a towel to prevent any frostbite or injury to the skin that you're applying the ice to. Heat can be helpful to injuries that are more of an older injury. So if you have a pulled muscle that is starting to become tense over time, or if you have some chronic joint pain or chronic injuries, the heat can be helpful to relieve some tension, to increase the blood flow to the area. Again, if you're using a heating pad, you should potentially wrap it in a towel to prevent a burn to the skin, because that can also cause some localized tissue trauma. If you have an injury that is not improving with ice or heat, I do recommend calling your pediatrician or your pediatric provider for further advice or maybe an exam in the office.